Welcome back. My name is Dr. Baird, and today I'll be teaching you 7 different variations of the squat movement and how you can use them to treat different areas of joint pain. As you know, the squat is one of those foundational movements that we use to limit impact that goes through our joints. And there are a lot of different variations that can help you improve movement patterns, mobility, and strengthen different imbalances to treat different areas of the body. So let's go ahead and get started with our first variation. The first variation is a simple body weight squat, also called an air squat. This is where you should start if you don't have any experience with the squatting movement, because it'll allow you to ingrain the squat movement pattern and target your hamstring and glutes to limit impact that goes through your joints. It also lets you experiment with your stance so that you can find the right stance that, again, limit impact that goes through your joints for less joint pain. So to perform, again, finding the right stance, you can mess with your width and your toe out. And from there, you're going to unlock at your hips, send the hips back, and squat down. That is a simple air squat. The next variation is called the ATG squat, also known as a deep squat. This is a great variation to help improve mobility, particularly at your hips and your ankles, and to strengthen your knees. Now, if you're on the stiffer side like I am, you can use an incline board to help you sink into that deep position. All you do is you put your heels up so that your heels are elevated. That'll allow you to sink into this position and come back up. And so this is the deep squat or ATG squat variation. The back squat is a weighted variation of the squat that targets your glutes and hamstrings to protect your lower back, and it also strengthens your legs to help protect your knees as well. So in this demonstration, I'm going to be using a sandbag, but you could also use a barbell that you place on your shoulders. So with the weight, I'm simply going to place it right on my shoulders and then perform that same squat movement where I'm unlocking at the hips and coming down. And that is the back squat. The next weighted variation of the squat we'll look at is called the front squat, which just means we're going to be holding a weight in front of us. This is going to shift the center of gravity forward to focus a lot more on strengthening the quads, making it a really good variation for knee pain. So to perform, again, you can use a barbell. I'm just going to be using the sandbag. I'm going to hold it right at my chest and squat down. And again, you're going to feel this a lot more in your quads versus your hamstrings and your glutes. The sumo squat is another variation of the squat exercise that you can use to really improve hip mobility. So to perform the sumo squat, we're going to take a much wider stance. I'm going to point my toes out at about 45 degrees, hands in the middle, and from there I'm just going to drop my butt down and come back up. And what you're going to notice is you really feel this in the hips, and it also lengthens your groin or adductor muscles as well, making it a great variation to improve your hip mobility. The overhead squat is really a full body version of the squat that's really going to incorporate more shoulder stability, core strength, as well as the traditional lower body strengthening of the squat. If you've never done this exercise before, I recommend that you start with something very light like a PVC pipe. All you're going to do, get as wide as you can on the PVC pipe. Start with it on your back, push it straight up, and from there, you're going to maintain this position as you lower your hips to the ground. And this is the overhead squat. The single leg squat is another great variation of the squat movement that allows you to strengthen each leg individually. Now, this is really important for treating joint pain because most people will tend to have a dominant side, especially if they've had a major injury or a surgery to one leg. And what can happen if you only do two-footed variations is subconsciously your stronger side takes over, and it can almost increase that muscular imbalance, which again can lead to more impact on your joint. So what we really want to do is train each side individually so that weaker side can work just as hard as your strong side. So to perform, I use an elevated surface because I do have limitations in my ankle and hip mobility that aren't going to allow me to sink fully into that movement. So I'm going to start on some blocks. From there, I'm just going to put one leg out in front and then simply Squat down on one leg, sinking as low as I can go. Again, I can't go very low. Some people can get their hips all the way to their heel, but you just go as low as you can go and come back up. That's a single leg squat. Give that one a try. There you have it. So there you have it. That is 7 different variations of the squat movement and how you can use those variations to treat different areas of joint pain depending on what you are experiencing. So I hope that this showed you how just changing the depth of your squat, changing the stance, changing where you hold the weight, all can influence what area you're targeting and how you're improving movement, mobility, and strength to target different areas of your body so that you can find one that really works for you. That's all I got for you today. Again, my name is Dr. Baird. If you have any questions, leave them in the comments below. Hey guys, it's Dr. Baird here, and I wanted to thank you for watching our previous video and supporting our channel. Now, if you're somebody who's looking to build strength, to solve joint pain, keep active, and maintain your lifestyle as you get older, be sure to subscribe to our channel to watch all of our new videos. You won't find it anywhere else.